So I'm here with JJ Bouchard, who works at Mott Children's Hospital. And JJ, tell us a little bit about yourself and a little more of your responsibilities.
Um, I am the patient technology coordinator, which is a role we've kind of invented here at Mott Children's Hospital. I've always used technology with all of my, not all of my, but with a lot of the different things I would do with the kids and with the families. I like to incorporate video games and iPads and all different types of technology to meet kids at their level and kind of help with the distraction and education. And so as the patient technology coordinator, my job is to find technology that's out there in different programs that use technology to educate, provide therapeutic distraction or intervention, and help incorporate that into the hospital environment.
Yeah, that's really good. And what sparked your interest in this field and the topic?
Well, I was actually diagnosed with type 1 diabetes when I was 7 years old. I was actually treated here at CS Mott Children's Hospital. And I played my very first video game here at the hospital. It was one of my fondest memories of, as you can imagine, being in the hospital for a week isn't fun for most kids. And there's definitely a lot of things that I did not like about being in the hospital, but I got to play a video game. It was kind of a way for me to, I was very shy, but it was a way for me to talk to staff. And when I was an adult later on in life, trying to figure out what I wanted to do with my life, my mom I was going down the road of becoming a teacher, but getting frustrated with some of the processes there and some of the limitations. And my mom reminded me of a gentleman named Jerry Reed who introduced me to the video games here in the hospital, and he was an activity therapist here, and said, you should do what he does. And so I went into recreation therapy, which uses recreation to help people reintegrate themselves back into society after traumatic experiences. And through there, I found child life. And so I kind of combined all of the knowledge that I got from there and integrated that into my practice here at the hospital. So I'm very lucky to be kind of giving back and doing what somebody did for me. I'm doing that, but on a kind of a larger scale. I'm able to kind of equip all of our clinicians here with all this great new technology like virtual reality and video games and online playing and things like that.
Yeah, that's awesome. And that kind of goes into your panel for South by Southwest, the advocating VR and gaming in hospitals. Can you kind of tell us a little bit about what the audience should expect to hear at the panel?
Oh, yeah, definitely. So I'm really excited. Our panel is made up of three different people that I've worked pretty closely with over the last couple of years. And each one represents kind of a different part of what we're doing. We're definitely going to be talking about how to just bring new technology into the hospital. Hospitals are for the most part, very reluctant or nervous to bring new technology in, just because of all of the different things associated with it. Even if it's just as much as like security or having something stolen or possibly being harmful to our patients or families. And so what I've done is kind of, and the people I've worked with is we've tried to create this kind of coalition of people who want to do good in the hospital. And we're going to be talking about how we all work together to make that happen. So we have someone who represents a school that teaches kids how to code and create their own video games. And they come into our hospital and go bedside with our kids and provide them with virtual reality experiences and teach them how to make their own video games. We have another gentleman from Child's Play, which is one of the largest charities in the country that is focused on providing video games for kids in the hospital, but they do a ton of other things, and talking about our relationship with them and their relation. He's going to talk about his relationship with hospitals all over the country and all of the good that's come out of that, but then also a lot of the roadblocks he's hit along the way and how we're working together to try to clear up some of those roadblocks. And then we also have a young woman from our safety program, and what she does is she goes out to the community and actually teaches kids about helmet safety, seatbelt safety, and basically all of the things that kids would get into when they're out in the world and how to stay safe and help prepare them for that. And so she's going to talk about how she works with me and how she works with all of these other two organizations to help educate kids about safety. And so how all of us together are not only making things happen here at Mott and bringing all this great new cutting edge technology to our patients and to our staff, but how other hospitals can do that and how we're working now with other hospitals to make sure that to help them have those opportunities as well.
Cool. Yeah. And so, for the people who end up going to the panel, what would you hope would be the greatest thing they take away from it?
I think the biggest thing is if they have an idea, even if it has nothing to do with technology, that they can make it happen. If they want to make something happen in their hospital, there is a way to do it. You just have to really be open to talking to other people and working with other people and realizing that the hospital environment is very different from the rest of the world. And you can probably do whatever it is you want to do. You're just going to have to work with others to make that happen. Yeah, I think the biggest challenge that a lot of outside organizations have is they really want to help people in hospital, but they don't understand all of the different barriers that there are. But also that there's a lot of things that these kids can do if we just take the time to do it right.